What's going on, everyone? This is your daily dose of mental health, and in this video we're going to be discussing benzo withdrawal and the dangers that come with it if you stopped abruptly. Before I go any further, if you could, please like and subscribe to the channel. I'm going to continue to put out content about a lot of things mental health related. I am a psych RN, but let's just jump right on into this video. Things I've seen in the inpatient setting and outpatient setting in regards to benzo withdrawal. Let's jump right on into it. All right, so first, as you can see, I made a little graph, and this just goes out for anyone who can't really see, who can't really hear. If you're having problems hearing, I wanted to make this chart, and my handwriting isn't the best, but this is some of the most important things I have seen in the clinical inpatient setting when it comes to benzo withdrawal. And this can be in regards to Valium being a common one, Ativan being another common one, Xanax being another common one, Klonopin being another one. And this video needs to be emphasized because a lot of people don't realize the big problem that comes with it when you do cold turkey to these kind of things. So the first thing I wanted to jump into is the dangers. One of the most important things that you will want to know if you're ever wanting to quit benzos is seizures. If you do not taper, notice right here, seizures, with the seizures. If not tapered, there is a high chance, depending on the dose you've been taking, or if you've been taking for a long time, chronic, if you've been taking them for years, that seizures can happen. So that's why I read on here, if you're not tapered properly, you could have seizures. And also I write right here, make sure you do have a consult with your doctor to discuss a way to get off benzos. Now, if you've been getting them off the streets or whatnot, that can be a different story. And I will make another video in regards to this. If, let's say, whoever you've been getting them from or whatnot, and you did not have a prescription for them and you were cut off cold turkey, I will make a video on some advice in the next week or so. That'll be my next video about benzos outside of a patient setting, what can help alleviate the withdrawal symptoms and possibly prevent seizures. Also, in regards to seizures, benzos as well are typically given to patients in the inpatient setting who are going through alcohol withdrawal. One thing when you're going through alcohol withdrawal, if you're a chronic drinker, you're at risk of having seizures. It attaches to the same receptors in your brain that benzos would. So in order to avoid alcoholic seizures, they will give you a benzo that'll help alleviate with the withdrawals, but in particular the seizures. So in the inpatient setting, you will be given benzos for a short amount of time, depending on how much you've been drinking. But the key is not to be on them for a long amount of time. But regardless, if you've been taking benzos in general for anxiety or for whatever reasons, some people use them for different reasons, anxiety, depression. If you're wanting to get off of them, please do consult with your doctor, and do remember, seizures is the #1 danger. It is, if you get anything out of this video, seizures is. I tell you this because a lot of times I know psychiatrists, they write prescriptions, they briefly go over, if you quit cold turkey, what can happen, and a lot of times you have to do your own research. So this is why it's kind of my summary of what I've seen in the inpatient setting, being an RN working in psych, on what I have seen from patients who have stopped abruptly benzos. #2, rebound anxiety. A lot of times when you quit your benzo, and even if you taper it, or if you're not going to taper it, if you don't taper it, if you don't have seizures, one thing you will have something called rebound anxiety. Some people might ask, what is rebound anxiety? Rebound anxiety is essentially anxiety that comes on that is a lot worse than when you were first put on the benzos. It can come in increments of 10 to 20 minutes where you feel like your heart's going to explode. You can have brain zaps where you can get lightheaded all of a sudden. Things like this. So I remember a patient telling me one time, with this, when he was tapering, he'd been taking, I think it was like 4 milligrams of Ativan for 3 years straight. He was down to 0.5 on a taper, and this is with the taper, And he was driving one day and he had to pull over because he got this lightheaded rebound anxiety thinking he was going to die. So that can happen. So that rebound anxiety, it's different from patient to patient, but that's just another thing to watch out for. It is normal to have a rebound anxiety. The case I just told you about, the patient who had to pull over, that's an extreme situation, but just realize you will have anxiety bouts and possible panic attacks. Number 3, right here, confusion. Kind of goes hand in hand with the last one. Confusion and intense 10 to 20 minute bout. It can be, once again, 10 to 20 minute bouts of confusion and anxiety that can cause blackouts. It goes with this. I wrote this as 2 separate points because the rebound anxiety, generally speaking, happens to most people. The story really applies to the confusion and intent, and the confusion and the intense 10 to 20 minute bouts really goes with somebody who's been using pretty high amounts of benzos. And this could be, once again, from Valium to Ativan to Klonopin to Xanax, all of them. So yeah, just realize that if you cold turkey it or even taper it, some of these things can be normal, but the number one thing that you want to avoid is the seizures. That's why the taper is the most important. Now, let's say you've been taking them, as I said, for alcohol detox in an inpatient setting for a couple weeks or even a month, like 1 to 2 milligrams. If you cold turkey it, the chance of having a seizure is lower. If you have a history of seizures, I mean, it could happen, but it's not that high. It's for people who've been using them for long bouts of time. Once again, before I go any further, please like and subscribe. I will be doing a video specifically for remedies that I've seen and patients have told me about that can help with benzo withdrawals if cold turkey is the only option you have, where if you have not been having prescriptions. So look out for that video coming out within the next week. Like and subscribe, leave a comment if that's a video you like. But let's head on through it and let's finish up this video. I want to keep these short and sweet. 4th thing, headaches, emotional swings, and cognition problems. Now, the headaches, emotional swings, and cognition problems all can go hand in hand. This can go with a lot of substances, opiates, opioids, even things, uppers, stimulants, like, for example, amphetamine salts, which is Adderall, Vyvanse, uppers, essentially. I write this because it's just going to be, regardless when you're stopping this, you're never going to, when you first stop, I always like to tell people, when you're feeling these thoughts, especially these right here, these emotional swings right here, it's normal. It's normal. It is very normal to have these. It's going to happen because your brain is balancing back out your chemicals, in particular your GABA. That's the brain chemical. And cognition problems, which, once again, meds that can be prescribed by doctors are things like Wellbutrin, antidepressants, and if you're really having problems where your just mood is really off, they can try some other things as well. I already said Wellbutrin, but that would be something to consult with your doctor as well. Now I was having problems with the lighting. I'm going to say it multiple times. Suicidal thoughts or suicidal ideation. Right here, please take note of this. When you are going through benzo withdrawal, if you have cold turkeyed it or even tapered it to an extent, suicidal thoughts can happen, and when they do happen, do not take them lightly. I'm telling you, suicidal thoughts from quitting things like this, please, please, please ask for help. Even if you don't know who to ask for help, please ask for help. Talk online. Put a comment down below if you're experiencing suicidal thoughts, and I'll get back to you. Because I will tell you, it's no joke. I know I've had patients before in the past who have gotten off benzos, who have cold turkeyed it, not had seizures, or even did taper, but the suicidal thoughts were so intense for them that they ended up ending it, and suicide is never the answer, and it's horrible. It's horrible. So if you're having suicidal thoughts, please, if it has to be online, if you're too scared or shy to tell anyone about it, family members, do not be scared. Let's eliminate the stigma. Also, for the suicidal thoughts, tell your provider, because there are medications that can help. With the antidepressants, as I said earlier, can help. And I know some people are like, well, that I don't want to replace a substance for another. Just realize that all of our brains are different in their specific, we all react differently to these if you go through these withdrawals. As I've said, in my past, I have a history of opiate use. So I know, even though it's not a benzo problem that I had, it was, I still understand a lot. In a way, I understand the emotional swings that come with a lot of this. Always taper. Lastly, big part as well, consult, and I put it in red, I hope it can be seen, consult with your medical provider if applicable. Do not, and I say it again, I've said it multiple times, do not cold turkey it. Meaning, if you're asking, what does cold turkey mean? Cold turkey means, and it kind of got blotted out right there, cold turkey means do not just stop them abruptly. It goes the same with antidepressants. It goes the same a lot of times with opiates. Any medication, really any psych medication that is changing your brain chemistry, you do not want to cold turkey it. The exception would be things like opiates, opioids, you'll go through some bad withdrawals. Heroin, same thing, but in particular, alcohol and benzos, do not cold turkey it, please. You can have a seizure, you can end up dying from that. So that is this video. The next video I'll put out is remedies that can help if you can't see a provider and if you have to cold turkey it. I'm gonna put a video out in regards to remedies that can help. However, I can't promote it saying that it will cure, but I can give you tips on if you do have to cold turkey benzos and not be able to see a doctor, and it's essentially over-the-counter remedies, things like that, and some herbal remedies. Once again, everyone, this is your daily dose of mental health. I love you all. I hope you're getting some general knowledge that a lot of people need to know about some of these substances. We're going to keep on pushing out more information. Once again, please like and subscribe. I'm going to go over a lot of different substances and a lot of the dangers of them. As I said, I am a psychiatric nurse that works in an inpatient setting, and a lot of these things that I write come directly from experiences I have seen from patients. And I write this because I care about all of you, and I want all of you to get the help you need. Please like, subscribe to the Daily Dose of Mental Health, tell your friends, share it, and leave a comment asking me a video if there's any substance you want me to cover. I've got other substances I've already touched on, meth, my own tramadol journey, which I can leave a link to if you'd like. But the next video will be benzo withdrawal, cold turkey, natural remedies. But this is primarily just generalized the dangers of benzo withdrawal. I love you all. Please like and subscribe. This is your daily dose of mental health. Leave a comment. I love you all. Stay safe out there. Look out for the next video. Love you all, and you all do matter.